Today we have with us Dr. Asfiya, who is a psychiatrist and the director of Ummeed Rehab and De-Addiction Center. She is an expert in the field with 8 years of experience. We are going to talk to her on the subject of addiction among the young individuals. Welcome to the interview, ma'am. So can you please explain to us how addiction affects children differently than adults?
The brain of the young adults are still in the growing stage. So if they get addicted to gadgets or to substances, the brain gets severely affected. The memory formation is affected. The memory formation does not happen. The concentration gets affected. The brain growth is stunted. So the children cannot perform cognitively as they would perform earlier without any addictions.
What are some common signs or symptoms of addiction we see among the children, and how can it be prevented?
See, the common signs will be that children are not concentrating in class, their development gets affected, they lose weight, they are becoming weaker, so they are not able to perform in their studies or in the extracurricular activities as they used to do earlier. So these are the signs of addiction in them.
What is the role of genetics or the environment in the child's susceptibility to addiction?
Yes, genetics does play a role. If the parents or anybody in the family is affected with addiction, then they have a greater chance of getting addicted themselves. So because they may have ADHD or they may have genetic predisposition to acquiring addictions, so from their family. So that is the role of family in addiction.
And what about the environment, the surroundings?
Yes, if they see their elders using substances, so it becomes natural for them to use it. So they feel that it is okay to use it. So they don't have that inhibition to start off. So that is why the elders, being role models, have to guide their children properly.
What can be the effective strategies for parents to guide their children to come out of addiction or prevent them from getting addicted to something?
So the adults have to be the role model for children. So if the adults are not showing that children that these things are okay, or they are being good role models and not doing any addicting substances at home or any behaviors which are addicting at home, then the children will also follow the same. But if the adults form good, bad role models, then the children will also start having those maladaptive practices in their life also.
So for the families who are already having children who are into addiction, what are the resources for them to come out of it?
They can take help from counselors, and they can come to a psychiatrist if the children are addicted to gadgets or to substances. So we can de-addict them by counseling, or sometimes if medicines are required, we can give them that. And second, you have to have the preventive strategies in place. So if you encourage these children to go into more extracurricular activities and have fun in their life in other forms, then you will be preventing the use of substances in these children.
What message do you have for the educators in the society to prevent children from getting addicted to substances?
I think the teachers play a very big role. So if they start teaching the children about the ill effects of addiction from a very young age, say by 5th standard, so then these children will not get addicted to substances, or they will at least have that inhibition in the beginning to use them. So the teachers can have say essays or painting competitions, or say in their talks, they can include these substances where you are dealing with preventive practices or the ill effects of drugs or something related to that. So you have to be creative, come up with creative themes, and let the children think about the ill effects of substances and inculcate those good practices in their life from a very young age.
How important do you think is early intervention when it comes to these things?
Prevention is better than cure. So early intervention is the way forward. So once they are addicted, it becomes very difficult for the children or anybody to stop it. So instead of wasting our resources in getting people to get de-addicted, we can prevent all these things by inculcating these practices at home and at school.
So, ma'am, are there any specific treatments or specific therapies that are tailored for children for them to come out of addiction?
See, there are no specific therapies as such, but the same principles are applied to the children as well. So, whatever we do for adults, the same thing, but in a way in which the children can understand and accept it. So, we do the therapy in that way. So, it is just tailored to the child's needs.
How can the mothers best support their children to prevent them from getting addicted to something, or if they're already addicted, to come out of it? What is the role of mothers?
The mother can be the guiding force for the children. So if they become strong and ask the adults in the household not to get into addictions or not to do it in front of children, so they can say that none of the addicting substances have to be brought home, or the elders should not be using those in front of children. So if they start implementing that, then the children will also inculcate those habits, and they will feel that these things are not accepted. So you have to inculcate these practices at home, and you have to teach the children that it is bad for health and it is not accepted even it is not accepted at all, and that is how the mothers can prevent it. And they have to talk to children from a young age about the ill effects of it and tell them that it is not allowed and I will not allow such practices to happen in my house. So they can be the guiding force for the children from a very young age.
So you being the director of Ummeed Rehabilitation and De-Addiction Center, what are the recent trends that you've seen among the children?
Okay, children are getting more addicted to gadgets these days. So after gadgets, it is cigarettes. So they become the gateway substances to other addictions. So if you can prevent these things, first gadget and then the cigarette smoking, there's a lot of pressure on the kids. So stress from their studies, pressure from the parents to perform well, and anxiety related to all these things are the major factors which push children towards these. So because they are getting anxious, they want to use something which de-stresses them or it reduces the anxiety. So that is why they go more into gadgets which are easily available at home. So the availability is also a factor. If we keep these gadgets away from them, then there's a chance that they will not get addicted. And easy availability of money. So when cash is available at hand, so kids don't hesitate to spend it on addictions. And a lot of kids are having ADHD which goes untreated, unnoticed and untreated, and dyslexia. So when kids are not happy in school or they are not able to perform well, and when they are pushed towards it, so they go more into addictions to just get away from all these stress.
Do you think religion or spirituality can play a role in helping them to come out of addiction?
Children nowadays are going away from spirituality. So they are not connecting with the Creator at all. So if we can establish this connect back again, encourage the children to go to namaz or start reading Quran with meaning, or attend classes where all these hadiths and Quran are taught in detail and in a way in which the children can enjoy it, then it will definitely pull them back towards Islam, towards their deen, and it will prevent them from using these substances or getting addicted to gadgets.
Can you tell us about this HSIS initiative and how it is benefiting all the classes of the society?
HSIS Hospital Cum Clinic is an initiative by the Haji Sir Ismail Seth Mosque and the Rotary Midtown. So they both collaborate and give services. Here we treat all kinds of patients, from diabetes, hypertension to psychiatric cases, and we have a few other specialities like gynecology, ENT, and orthopedicians also visiting us once a week. Okay, and all the treatment here is given free. So even the medications for a month is given free here, and patients come back for follow-up every month and avail these services. So you have right from children to old age people, and even the you have the old age home patients who are staying with Anmol Sahara. They also come and visit us for their free consultations.
So what are the kind of cases you usually see here at this hospital?
So I see all general psychiatric cases, from schizophrenia, bipolar, depression, anxiety, to marital issues, to interpersonal issues. So we do give medications as well as free counseling to them as well. And even children come in. So with a lot of ADHD cases come here, and dyslexic patients also come for evaluation, and we treat these patients as well.
So how is the success rate? Are people benefiting, and are they keen on following up?
When people see and notice the change they are undergoing and they see the benefit, the family members or the neighbors around them who see this change in them, they are motivated and they come for treatment. So all our success has been through word of mouth. So whatever cases come to us are all through word of mouth.
Thank you, ma'am. Thank you so much for joining with us today. We were talking to Dr. Asfiya, who is a psychiatrist and the director of Ummeed Rehab and De-Addiction Center. She was shedding light on the factors contributing to addiction among the children and what can be the preventive measures. Thank you. This is Alia Amreen for Karnataka Muslims.